So on the show today, we have Dr. Gemma Beckley of the Meditation Trust. Gemma is a clinical psychologist and independent transcendental meditation teacher. The Meditation Trust is a registered charity and has as its mission to make transcendental meditation accessible and affordable for all, especially those in recovery from addiction and trauma, which are particular areas of interest for Gemma. So Gemma, it's lovely to have you on the podcast today. Thank you very much for joining us.
Thank you for having me.
I think you're going to be speaking at the Embodiment Conference coming up in later on in the year. So this is really a chance for people to get to know you in a little bit more depth and to find out a bit more about your background. Just a bit of a sneak preview, I guess, before coming into the actual podcast itself. So I'm really happy that you're able to join us today. How are you today?
I'm very well, thank you.
Good. Great. So I thought perhaps we could start off just, I guess, with a bit of background. So how did you get into transcendental meditation? You know, what's really brought you to this and what's been important about it for you personally?
Yeah, well, I have a probably slightly unusual story in that I was introduced to transcendental meditation when I was 6 years old. That's not most people's route to finding this technique, but what had happened was my father had discovered TM a couple of years previous to that, and the way he came upon it was because he was suffering from anxiety and depression, and he was on lots of prescription tablets from the doctor, and he always says how he went along and to his GP one day and was told he was addicted to his medication, sleeping tablets and anti-anxiety tablets and antidepressants, and it was at that point that he realized he really had to do something else about this, that he didn't want to be living as he was, kind of semi-aware of what was going on around him and living in this state of just about keeping his head above water. So he'd heard a conversation. He'd overheard some people talking about TM previously. He recalled that conversation and so decided to look into it. He went on and learnt, and he was very pleased with his results. It took him a little bit of time because of the state that his body was in. It took him a little bit of time to notice the profound results that were starting to come through. But after some months, he suddenly realised he'd forgotten to take his medication. Not that we recommend that, but he'd forgotten to. He just hadn't realised that those tablets that were supporting him, he hadn't needed any longer, and his alcohol consumption reduced. He'd stopped smoking, and there's all sorts of dramatic results going on. So in any case, within a couple of years, he introduced or suggested the rest of the family go along and learn. So I went along with my sisters and my mum to a residential place where they were running courses, and I learnt, and I learnt the children's technique. Children can learn from the age of 6, so I learnt at the earliest possible age, and it's a slightly different technique to the adult technique, which you can learn when you're 10. So I learnt that technique and did my twice a day practice, probably sporadically. This is one reason why I have an interest in getting TM into the education system, because I really believe if I'd had that as part of my normal system, my everyday system, where all my peers were practicing this technique, it would become the normal, and it wouldn't be down to the parents and the family members to encourage the child to practice. Anyhow, I sort of dipped in and out, and by the time I was 10, actually, my father had trained to become a teacher. It culminated in about 9 months in residence in total after many years of practice. And so by the time I was 10 and able to learn the adult technique, he was able to teach me, and he was teaching for Maharishi Mahesh Yogi's organisation on behalf of them. In the mid-90s, he left them and became an independent TM teacher, and then founded the Meditation Trust in 1999. But my journey went off on a tangent in terms of, I found myself particularly interested in, probably because of the the journey I'd seen my father going on with his mental health problems, and also probably my experience of the school years of academia and the challenges of the stress that brings upon, and probably my genetic tendency for anxiety and depression. I found myself curious about mental health and wanting to know what the mainstream was saying about understanding mental health problems. And so took a path into psychology, doing my degree and going on to train as a clinical psychologist with the NHS, and ultimately doing the doctorate. But all the time in the back of my mind, I had an awareness of that knowledge of TM, and probably got back particularly into my TM practice, because once you've learned, you've always got it there to go back to. So I dipped in and out, and then by my early 20s, when I'd really appreciated why people come to learn, after I'd accumulated some substantial stress during the university years, I seriously got back into the practice, and it really helped me through the rest of my academic career. What was interesting for me, by the time I qualified, actually while I was training, I would say, probably about 15 years ago or so, mindfulness techniques were coming into clinical practice. And I was, with this knowledge of TM still in my awareness and in my everyday practice, I started to become increasingly interested in the relationship between the two. How would TM fit into this clinical picture of modern psychology? How and where would it fit? Could it fit? I found myself doing research in that respect, both in my undergrad degree and my postgrad doctorate. I did my thesis on TM, the effects of TM on anxiety and depression, and really started to explore that relationship. And as I say, with mindfulness techniques starting to come in, which I was using in the NHS, as many psychologists were and still do, started to explore more and more what was the relationship between mindfulness in particular and TM practice, and started to come to more and more of an understanding. A few years after qualifying, I decided that which are pretty much talking therapies within psychology, could only take people so far. I started to feel a bit frustrated by the lack of progress I could help people make. I was aware there was something significant that was missing from the whole picture. And so I left the NHS for a time, went off travelling. At the end of my travels, I found an independent TM teacher trainer, and spent 3 months up a mountain in Bali training with him and a group of colleagues from around the world, and qualified as a TM teacher, and came back to the UK and became a full-time TM teacher. And as I said, during that time, my father had founded the Meditation Trust, and I started to work with him to develop the charity and to work on this mission of the trust of making TM accessible and affordable, whilst maintaining my interest in psychology. I'm still a registered clinical psychologist, and so still looking at that relationship. But my full-time work is now as a TM teacher.
Okay, thank you for sharing that. That's quite a story from your father's experience and then going through learning as a child. And I'm fascinated about how you're bringing together, I guess, the psychology, your experience with that, together with your experience with the TM side of things. And you mentioned that you're doing some mindfulness techniques as part of the clinical psychology, and I'm curious if you can explain a little bit of what you would see as perhaps the difference or the different benefits between mindfulness and TM, what they can each bring.
Yeah, and that was something I had to explore quite a bit, because on the surface of things, I often get asked this question when I'm teaching the TM course. When we're talking about the procedure and the practice, so many people now have practiced mindfulness techniques, whether it's at the end of the yoga class or on the online apps and things, and people often want to understand what's the relationship, what's the difference, how they appear on the surface to be similar techniques. but they are in fact quite different. And I've realised that it's a big area of misunderstanding, that so many people think that meditation is just meditation. They just refer to meditation as if it's one thing. And even when in articles and things, people refer to meditation and quote research from all sorts of different techniques all in one paper, or all in one article. And they are different. They're different processes. They have different outcomes. They have different effects on the brain. And so, but my understanding of this relationship continues to develop, because when I was using mindfulness in the NHS, it was very much used as a technique for encouraging present moment awareness by using, in particular, the breath, sometimes the body, sometimes an object or any activity, but more often than not the breath. And I think that's what what most people, that's the most common way for people to use mindfulness these days, is mindfulness of breath, returning the attention to the breath. Mindfulness off, returning the attention to the breath. And that it's for most people, I would say the emphasis is on, as it was when I was working in psychology, of settling the mind, enabling the mind to be more present, calming the mind down. People want to be more mindful, more in the present, and have less turbulence in the mind. And it's used as a way of, like in psychology, we were using it as a way to it particularly came into psychology as a way of changing our relationship with thoughts. Mm-hmm. The point being that one of the most common therapies that was being used, probably still is being used, is CBT, cognitive behavioral therapy, where for decades now we've been analysing thoughts. What's your thought? What's your thinking pattern? Where's your thought distortions? Analysing those thoughts. Where psychologists started to realise, actually, when I looked at Jon Kabat-Zinn's work in the States on mindfulness, they realized that actually there was some crucial component about changing our relationship with our thoughts, not just the content of the thought itself. And so that's the way it's predominantly used in psychology. And I think, as I say, the way that people are predominantly using it with these meditation apps now as a way to settle the mind and not get swept away with our thoughts, our feelings, our emotions. And so mindfulness is used as a way of, to some degree, controlling the mind. It's kind of cultivating a certain state of mind. Now, it's not the same degree of controlling as you see in what most people think of as meditation. And the most common idea of meditation is that it's about concentrating or controlling the mind, forcing the mind to be still. You'll have heard these analogies of the monkey minds, and so many people say this when I do introductory talks. They'll say, I've tried to meditate, but my mind's like a monkey mind. It leaps around all over the place, like monkeys in the trees, leaping around from branch to branch. And it's been said in certain traditions that involve concentration or control that, well, what we need to do, the problem with the mind is we're getting swept away by these thoughts and feelings. We're getting caught up in that. We need to catch the monkeys, tie them down, keep them still, control the mind. I think it's useful at this point, before I go any further, to introduce an analogy that comes from the Vedic tradition of India, from where Transcendental meditation comes, to explain the relationship between different techniques, including mindfulness and TM, and how they work. And very helpfully, a few years ago, there was a couple of researchers that came up with 3 main categories of meditation. Because of all these so many different techniques out there, it's very easy to get confused as to why this technique or that technique, and how do they all relate. And they did put mindfulness into one of these categories. So first, to explain the analogy that's often used for the mind, is it's often been said that the mind is like an ocean. If you think of an ocean, maybe you're standing on a cliff and looking out to sea. What you can see, if it's a stormy day, as it is today, is lots of rough crashing waves on the surface of the ocean. You see lots of activity going on, and you'd quite rightly say, if someone was stood next to you, turn and say, "Oh, the ocean is really active today," and that's true. Yeah, that's true. You're not making it up, but it's not the entire truth. Mm-hmm. The entire truth is that if you were to get out into a boat and to dive over the side of the boat, Anyone that's ever been scuba diving will have had this experience that there's turbulence on the surface. No matter how much turbulence there is on the surface of the ocean, you dive down and the ocean becomes more and more settled, more and more settled, more and more settled, until ultimately you reach a silent depth of the ocean.
Yeah.
And this analogy has been used for our minds. And so when people say, oh, my mind's like the monkey mind, it's very active, that's not the entire truth. Your mind, you may experience your mind as active, but in fact your mind also has a silent depth. Everybody's mind has a silent depth.